Hello, Portland. Thank you. It happened because people had the courage to stand up at town hall meetings and talk about how insurance companies were denying their families coverage because of a pre-existing condition. It happened because folks wrote letters about how premiums had gone up 50 or 70 or 100% in some cases, and it was forcing them to give up their insurance. It happened because countless small business owners and families and doctors shared stories about a healthcare system that was working better for the insurance industry than it did for American people. And when the special interests sent an army of lobbyists to Congress and blanketed the airwaves with millions of dollars of negative ads, all of you mobilized and organized, and you refused to give up. And when the pundits were obsessed over what the polls were saying and who was up and who was down and what would this mean for Democrats or Republicans, you never lost sight of what was right and what was wrong. You knew it wasn't about the fortunes of one party, it was about the future of our country. And today, Portland, because of what you did, the future looks stronger and more hopeful than it has in some time. Now, over the last year, there's been a lot of misinformation spread about health reform. There's been a lot of fear-mongering, a lot of overheated rhetoric. If you turned on the news, you'd see that those same folks who were hollering about it before it passed, they're still hollering about how the world will end because we passed this bill. So after I signed the bill, I looked around. I looked up at the sky to see if asteroids were coming. I looked at the ground to see if cracks had opened up in the earth. You know what? It turned out it was a pretty nice day. So before we find out if people like health care reform, we should wait to see what happens when we actually put it into place. Just a thought. Look, this reform is not going to solve every problem with our health care system. It is a huge, complicated piece of business. A couple of $1 trillion. Thousands of people affected, thousands of people working in the industry. It's not going to bring down the cost of health care overnight. We're going to have to make some adjustments along the way. But it represents enormous progress. It enshrines the principle that every American should have the security of decent care, and that nobody should go bankrupt because they've got a kid who's sick with a pre-existing condition. That small businesses shouldn't be burdened because they want to do the right thing by their employee. So now that this bill is finally law, and all the folks who've been playing politics will finally have to confront the reality of what this reform is, they're also going to have to confront the reality of what it isn't. They'll have to finally acknowledge that this isn't a government takeover of our health care system. They'll see that if Americans like their doctor, they will keep their doctor. And if you like your insurance plan, you will keep it. No one will be able to take that away from you. What this reform represents is basically a middle-of-the-road solution to a very serious problem. It's not single payer. Some people wanted that, I understood that, but that is not, see? But, so, you know, it's not that, but it's also not what the Republicans were advocating for, which is essentially that you completely deregulate the insurance industry, you let them run wild, and that somehow you were going to benefit. That was their theory. It was called the foxes guarding the chicken coop healthcare plan. So it's not the plan that some on the left supported in the past. It's not what some on the right supported, but it is a common sense plan. This reform incorporates ideas from both Democrats and Republicans. Now, Portland, it'll take about 4 years to implement this entire plan because we've got to do it responsibly. We need to get it right. But there's also a set of reforms that will take effect this year. So I want everybody to understand what's going to happen this year. Starting this year, millions of small business owners are going to be eligible for a tax credit that will help them cover the costs of insurance for their employees. So this health care tax credit is pro-jobs, it's pro-business, and it starts this year. This month we're going to be sending out details on how to apply for this credit to millions of small businesses across the country. Here's what else happens this year. Tens of thousands of uninsured Americans with pre-existing conditions and parents whose children have a pre-existing condition will finally be able to purchase the coverage that they need. That happens this year. So that's just one of the insurance reforms that starts this year. Here's what else happens. Insurance companies won't be able to drop people's coverage when they get sick, or place lifetime limits or restricted annual limits on the amount of care they can receive. Starting this year, all new insurance plans will be required to offer free preventive care. And starting this year, this may interest some of you here, if you are a young person who doesn't have insurance or doesn't have a job that offers insurance, you're going to be able to stay on your parents' insurance policy until you're 26 years old, starting this year. This year, seniors who fall into the coverage gap known as the donut hole, some seniors probably know about that, they're going to receive $250 to help pay for prescriptions, and that's just the first step, because what we're going to be doing is, over the next several years, closing that gap completely. And I want seniors to know, despite some of the stuff that's been said out there, these reforms don't cut into your guaranteed benefits. What they do is eliminate co-payments and deductibles for preventive care, like checkups and mammograms. You will be getting those for free now. This is why AARP supported this bill, because it's good for seniors. It's the right thing to do. It's good for young people. It's the right thing to do. It's good for people who've hit these lifetime limits. It's good for people with pre-existing conditions. All that happens this year. We're giving tax breaks to working people, some of them working 2-3 jobs, who still can't get insurance. We're going to give them some help. We're going to give small businesses help so that they can help their workers and improve their bottom line. And we've got a whole bunch of insurance reforms so people like Teresa aren't going to be disadvantaged and taken advantage of when they need it most. That's what this bill is. And it's paid for. And it saves on our deficit. Now, this is what everybody's been hollering about as the end of freedom. And now that it's passed, they're already promising we're going to repeal it. They're going to run on a platform of repeal in November. And my attitude is, go for it. You try to repeal it. I want these members of Congress to come to come out of Washington, come here to Maine, and tell Mr. Milliken there, you know what, we're going to take away your tax credits, essentially raise your taxes. If they want to do that, be my guest. If they want to look at Laura Gallagher in the eye and tell her they plan to take away her father's ability to get health insurance, that's their right. They want to go tell Teresa that once again you could face a lifetime of debt if you lose a family member. They can run on that platform. If they want to have a fight, I welcome that fight, because I don't believe the American people are going to put the insurance industry back in the driver's seat.
President Obama's visit was just one of the many steps he's taking to assure Americans of the advantages of health care. Reporting for WEBN News, I'm Mombi Michelle Kimani.